All right, folks, this is the last portion of the lower cervical setups. Um, we are in the seated position, patient's in the seated position, and we've got two setups to do for this. One is going to be a push move. I'll be standing behind the patient. The other one's going to be a pull move, and I'll be standing in front of the patient. We'll start, since I'm behind the patient now, we're going to start with the push move. Now, the table that I have right here has the patient up a little bit higher than I would like for my height. So you have to stop and think about where the patient's positioned so that you have the effective contact and you can adjust the patient as you need to. Now, again, we are going to have a lateral index contact between the PIP and the DIP, okay? Now, what I'd like you to do, patient's facing forward, I'd like for you just to place your hand on top of the patient's head. This is so that her head does not move, or the patient's head does not move, when I start to take my tissue pull. And I'm going to use lateral index contact. I'm going to start midline posterior back here, as you can see. And then I'm going to pull laterally out to that articular process, okay? You'll notice that my palm is up, okay, and I'm stabilizing your head so that it doesn't move when I take that tissue pull. Now, I need to slide this stabilizing hand on the top of her head into the position it's going to need to be in. And for a push move, I am going to slide the hand down, fingers pointing down, cupping the ear. Then I'm going to laterally flex over my contact and then rotate. If I'm in the upper cervicals, I'm going P to A, I to S. Mid-cervical, I'm coming straight across. And if I'm in the lower cervicals, this is where the problem would be with the patient up too high. I'd have to be able to thrust a little bit S to I, okay? So this would be a little bit too tall for me. But this is our push move in the seated position, okay? Now, I'm going to come around front. Now we have a pull move, and it is exactly that. You're going to pull rather than thrust, pushing straight through. Now, my contact is a broad contact between the PIP and the DIP of my chiropractic index finger, okay? Now, I'm standing in front of the patient off to one side. So, if I'm adjusting for a left rotation restriction, I would be standing on the left side of the patient, okay? Just as I am right now. I'm going to take my left arm, I'm going to reach across in front of the patient, and I am going to find the segment that I'm making my contact on, let's say C2 at this point. I'm going to place my hand on top of the patient's head so it doesn't move when I start to take a tissue pull. I'm going to pull medial to lateral, P to A, out to that articular process. Now with my stabilizing hand here, all I'm going to do is let it slide down, cupping the ears. This time fingers are pointing upwards or up and back. Then I'm going to laterally flex over my contact. Okay. And then I'm going to rotate the patient's head. Most of the time the patient's going to be looking up at you just about. At this point, I'm at C2, so I'm going to want to pull P to A, I to S. I'm going to come back and up slightly toward my shoulder. If I'm in the lower cervicals, I'm going to pull down slightly, okay? That's our pull move. Now, a couple of things in the pull move. I see a lot of people make the mistake of wanting to rotate the patient's head as far as they can get it, okay? Again, we're laterally flexing, then rotating. You'll notice that it limits the amount of rotation just by doing that, okay? And we don't want excessive amounts of rotation, or for that matter, excessive amounts of extension like I see a lot of people do, okay? Keep them in a neutral position as much as you possibly can. Now the other thing that we want to be sure that is we do not do in performing this particular adjustment is I do not want to step in between the patient's legs here, okay? You're always going to stand to the side or even out in front if you're tall enough to reach, your arms are long enough to reach. Now, I know with us guys, we tend to sit with our legs spread a bit more than the ladies do. It's okay. You can come in here and you can ask the patient to bring their legs together so that you can step in a little bit closer to make effective contacts if you're too far away from them. Okay? Lines of correction stay the same depending on what segment that you're contacting. Above C4, P to A, I to S. Below C4, P to A, S to I. And at C4, P to A, straight across. Okay? And that's our seated contacts for cervical adjusting C2 to C7.